right. Good morning, everybody. Welcome to Health Equity Grand Rounds, a very special edition of Health Equity Grand Rounds. First of the 2024 year, and the very, very special guest this morning. I think he needs no introduction to some here, and I know he's impacted a lot of folks who have come through this program in the years since he's was here as a trainee. He's someone whose name I've heard many, many times since I've been here, and really excited to meet him in person and to get to hear about his work this morning. So Dr. Zach Self is the founder and medical director of the Clínica Médica Cristiana in San Tomás La Unión in Guatemala. He has done that since November 2010, which I believe was during his residency that he started doing that, and has been there ever since. Prior to training at BCMC, which he completed in 2011, he got his education at Rhodes College and the University of Tennessee College of Medicine. I think he's a really great example of the impact that this incredible training program prepares people to have on the world. And again, it's a great pleasure to have you here, Dr. Self.
Thank you for the kind introduction. This is the first time I've been a special edition. That's a lot to live up to. So I do know most of you, those that I haven't met. I'm Zach Self, and hope to share a little bit about our work in Guatemala with you this morning, and some of the challenges to care there, and some of the ways we've tried to address those challenges. These first few slides were additions by Vicky, so I'm not too familiar with them, but thank you to the CME committee for having me. It's good to be back to Ventura. It's been a few years since I've been through, and it's good. I need to read any of this. Okay, and you guys don't. So there's where what I'm familiar with in terms of my slides. Unapologetically unreasonable. We'll get into the reasoning behind the title as we go through the slides. The talk, you can probably break up into three parts. The first part will be more show and tell, kind of construction and design of the clinic. And then the second part is a brief episode of working with the Guatemalan public health system, not necessarily by choice. And then the last part is a couple of patient cases that I'll share with you as examples of the care that we are able to provide. And so that's more or less what I said. And as was mentioned, I did train here. There's a picture of our class. The guy on the left is with us this morning, so he's a special edition, Dr. O'Brien. And then if you can't pick me out, I'm the handsome gentleman second from the left with the same neatly cropped hair. And then, as Zadok mentioned, this program does prepare residents to work pretty much anywhere in the world. And where we are in the world is Guatemala, so just south of Mexico, you run into Guatemala, and specifically we're in the southwest region, what many would refer to as the Boca Costa, so not quite highlands and not quite coast, kind of in between. We're around 3,000 feet above sea level, so the climate's pretty nice. It's sunny and lows in the 60s, highs in the 80s year round, and then half the year it rains most days. Currently not raining most days, so that's nice. And then in terms of why that corner of the globe, this is a younger version of me with my wife of 20 plus years, Josefina. So during undergrad, I took some time off and was volunteering with a different organization there in Guatemala. And I was working with a physician and she was working with the dentist. And that's when we met. And then once I was accepted into medical school, I deferred matriculation for a year and we got married during that time. And so that her family ties to that area. She's one of 5 sisters, and all of she and her 4 other sisters were literally born and raised right on the same piece of land where our house and clinic is. And so that's the explanation in terms of the geography. And Taylor, who's there on the left, is Venturan. At least currently he lives here in the area. He's an architect. And the reason he appears in the presentation is because he's the designing architect of our home there in Guatemala and also the clinic, as well as the current construction project we have ongoing. But he's husband of Cubby Simpson, who was one of my residency classmates. And so that's another VCMC connection. There we're enjoying some farm to table fresh organic coconut water on one of his visits to supervise construction. And this is one of his early sketches of the design of the clinic. And so I think I'll orient you to the clinic a few slides later, but that's the start of it. And this was breaking ground. So the first day we broke ground on our home there in Santo Tomas in Guatemala. And that was probably my second year of residency. I don't know what the moonlighting situation is currently or the OB backup, but I did a fair amount of both when I was here. And that's largely what financed the construction of our home and then the start of the clinic construction. And so I'll go through the construction pictures fairly rapidly, but it's a little bit of a time lapse. And so you can see the walls going up. So some big rocks. There's our house. It's relatively unchanged. Today it looks pretty similar. And so that's where Josefina and I and our 4 kids, ranging in age from 5 to 15, live. And that picture is actually taken from the roof of the clinic. So just to situate you in terms of the site, the clinic's right across the driveway from our home, for better or worse. And there's the construction team for the clinic, and then some more excavation. All of that was done by hand. And there's a meeting of the minds discussing the construction plans. Al Taylor appears there as well. And then walls going up. Like I said, I'll go through these fairly rapidly, but just to give you an idea of the background in terms of our center. And this was ongoing during residency and shortly thereafter in terms of construction of the clinic. And then the pour of the slab, so the concrete roof and the transition between first and second floor, and also the concrete roof, kind of a bucket brigade. And then you can see a room there on the top of the clinic. The only reason I mention is because it was originally designed as a conference room / sign out area. We didn't ever really use it too much for that purpose, but then more recently, over the last few years, we remodeled it to a studio apartment. And so that's where visiting providers stay when they come to work with us, just to begin to plant that seed for you. And along the outside and also the roof of the studio apartment is some bamboo work, which is nice touch. And so that's my oldest daughter, Andrea. She was actually born about halfway through my intern year here at VCMC. She's a little older now. She just had her 15 años, so that's a big birthday blowout down there. And then there's some more of the bamboo. And so that's inside the studio apartment, the bamboo and tile. And there's more or less the finished product. So from here, I'll kind of orient you. This wall is the waiting room, and now that has a large mural painted by a local artist. And so the way that the clinic design works is people come in through this main gate over here, and if for outpatient care, they're kind of funneled down this walkway past the waiting room, and then this corner is reception. We use a iPad-based EMR, and then off in this corner that you can kind of make out, there's a door that goes to pharmacy and vital signs area. And then the second floor, which has ground level access, as does the first floor. Second floor is more geared towards ambulatory care, outpatient clinic. And so these doors over here are outpatient clinics. And then this door is a doctor's work area. The other kind of guiding philosophy of the design was kind of a central command center. So providers, whether they be on the first floor or the second floor, have visualization of people coming and going, and also pretty easy access to patients. And then the first floor through here there's double doors that go to an OR, a garage that now houses an ambulance. That's probably our newest addition. And so it's nice to have an ambulance. And then this is just storage. And over here, doctor's work area again, and our on-site lab. So we have on-site pharmacy and on-site lab. And then this wing of the first floor is more for acute care. So we have space for 2 to 3 inpatient beds, and then also a large recess area. So that's the clinic.